So this is part two of the theory lecture. And here we're going to start by focusing on theory and nursing practice. So basically a theory that guides nursing practice would be an organizing framework that contains concepts and purposes designed to guide the practice of nursing. So it's going to explain, describe, predict, and prescribe nursing practice. So the nursing process is something that can be used to guide where theories fit into your actual nursing practice. And they may fit at different points in the nursing process. There might be a theory that's more appropriate for gathering data, for planning, for implementing, and quite often for evaluating. So this diagram shows the cyclical and ongoing nature of the nursing process, where you're going to assess, analyze, plan, implement, evaluate, and then you're going to go back and assess. So some theories are going to guide nurses from the assessment through the evaluation, but other theories may only apply to a specific aspect, such as assessment, rather than the nursing process as a whole. Theory also plays a large role in nursing knowledge development in that it interacts with nursing research. So we have theory, practice, and research, and these things combined become nurse practice standards or evidence-based practice. So some research is theory generating, and that's that observation and findings lead to a theory. And this is usually viewed as an inductive approach. Florence Nightingale's environmental theory is an example of how she used observations to develop theory. And her theory includes the components that pure air and water, effective drainage, cleanliness, light, including sunlight, reduced noise, and patients' dietary needs are important components of the healing process and things that are influenced by nurses. You may have heard Florence Nightingale referred to as the lady with the lamp. This was because she was at the bedside collecting data. And back then it might have been on the notepad, but today it could be on iPhone, or it could be on some other data collection device. And that collecting this data about patients and then analyzing the data and applying these results to change practice and change environments of care are huge components of evidence-based practice that were originally used by Florence Nightingale. An interesting fact about Florence Nightingale is that she was a pioneer in the graphical representation of statistics. She was known as an early statistician, and she used these polar area graphs to illustrate the findings that she had, and she felt like this really helped get her point across. And so here you could see that this polar area graph is of the causes of mortality in a field hospital, and they include battle and non-battle causes. And if you notice right away, the non-battle causes of mortality are higher. And so these are the things that she really wanted to address as part of her nursing practice. Nursing informatics is very interested in how we use data to create information, information to create knowledge, and knowledge to create wisdom, and that we synthesize these things and they become more complex. So many people consider Florence Nightingale one of the first nurse informaticists. So this diagram is used by nursing informatics as part of the scope and practice standards of practice for nursing informatics, and is considered the DIKW, or the Data Information Knowledge and Wisdom Continuum. And this particular diagram illustrates the flow and the flux that goes between these things and how they increase in complexity. So for instance, if you're looking at data, you're naming, collecting, and organizing. Maybe you have two numbers. You have the number 80, you have the number 120. You're not sure what they are yet. Are they heart rates? What are they? Well, when you look at them together, you realize, oh, that's a blood pressure. So you have information, and you're organizing that information and interpreting. You may then look at the trends. Is this the patient's normal blood pressure? Is this a change? And is it normal? Is it abnormal? And that's where your knowledge comes in from your practice and your experience, where you're going to then interpret, integrate, and understand. And then wisdom is taking that information and applying it with compassion. So in its flux, it's not like this is just the only thing you're doing. You're looking at this with numerous amounts of information that come your way. So the nursing process is basically to analyze and evaluate. So this is an example of how the particular structures, these meta structures of data, information, knowledge, and wisdom can be applied to health information technology. And health information technology is something that's meant to support nursing practice. So you have an information system such as electronic health record, and there you input your data and it becomes information, and you have this information system. A decision support system would be where there's a variety of different algorithms and things built in, information. So a lot of electronic health records have this built in where it will bring up things such as drugs that are incompatible with one another. There may be decision support systems that will warn you if the patient is at risk of skin breakdown or falls based on some of the information that's in there. And then wisdom is where you would then apply that. And these expert systems that are being developed are actually have surveillance of the patient record, so it can alert you ahead of time that this person has just returned from surgery and they are at higher risk of skin breakdown or falls. And so that these expert systems would then help support, but it's always the nurse themselves that's responsible and in their particular judgment. So there's a lot of theory that goes around into the development of these different health information technology systems that support nursing practice. So there's another type of research, the test theory, that you start out with theory and then you see whether or not it actually is going to work. What are your observation and processes? And so from the theoretical statement, you develop hypotheses and research questions. And then this is usually thought of as a deductive approach. So for this, I'm going to provide a non-nursing theory example. So this is the theory that actually guides a lot of my research, and it's complexity science, and it incorporates multiple interrelated theories. And so the theories focus on complex adaptive systems, and it says that they evolve, interact, and maintain order. So complex, it means they're made up of a bunch of different things. They have a large number of connections. Adaptive means they have the ability to change, and a system means that multiple agents are interdependent and connected. So some of the examples of this could be cells and organs within our body, patients, family communicators, and healthcare providers within healthcare organizations. And these theories also recognize that a small change may produce a large effect, or a large change may produce a small effect. So you have to be really aware of this when you're going to implement any kind of change or practice change. So this is from an early research project that I did, and I was interested in how a hybrid system, an information system, one that's made up of both paper and electronic documentation processes or communication processes, would influence the exchange of information between providers during patient transfer, which would be the handoff from the emergency department to an inpatient unit. So as part of my research, I developed a conceptual model. Like, what exactly did I mean by complex adaptive systems being embedded? So this diagram illustrates how the individuals are complex adaptive systems that have the ability to adapt and respond to the environment. The units themselves, the admitting unit, the emergency department, are complex adaptive systems that are embedded within the healthcare organization, which once again has a lot of things that influence it. And I viewed this patient handoff as an emergent situation where people came from both sides, both units, came together to do the task in order to safely transfer a patient and provide the information to resume care from on an inpatient unit. So what did this mean in my research? I was looking at the patient information documentation process, and this is a diagram that shows you some of the complexity, where you had phones, you had computers, there were medication records, people called one another, they could talk to there were paper charts that were put into a system and scanned and then available in the electronic record. There's computerized provider order entry that then went into the EHR. So you could see all the complex factors that interplayed in this particular process of transferring the patient. And this diagram shows the various communication methods used by the admitting unit charge nurse. This was the person who took report from the emergency department and gathered the information necessary to take care of that patient. And so you could see how complex this is. On one side, we have the inpatient unit, and then on the other side, and that's represented by ED. And on the other side, we have AU, which is the admitting unit. And you can see that there were a variety of ways people talk to one another, and that this person had to collect a tremendous amount of information in order to pull it together to determine the care plan for that particular patient. So that example showed, in most of what it showed was the healthcare organization as a complex adaptive system. But there are people that study the human body as a complex adaptive system that's made up of physiological regulatory mechanisms, feedback loops, homeostasis. These are things that you had in pathophys and A&P that you're aware of. But these are things that are dependent on one another, and that a small change in something like your thyroid output could affect your entire body. So, complex adaptive systems and complexity science could also be used to look at personalized care, looking at an individual's needs or the needs of a particular age group. So, for instance, blood pressure goals may need to change with age. Frail elderly may need a different level of control and ideal blood pressures from somebody who's younger. So, for example, among elderly adults, higher systolic blood pressure was linked to a greater likelihood of dying over a 5 year study, only among faster walkers. Participants who couldn't even walk 20 feet, those with high blood pressure, were less likely to have died. And this is a very interesting study. So here they are talking about rethinking the association of high blood pressure with mortality in elderly adults, the impact of frailty. So this is something that needs to be considered, and this is where complexity science would look at the contextual factors and not just have a particular goal for everybody. So here's another example where you might want to look at complexity science, where there's something that's happening and it's not a direct association. It may take some investigation. So early on, when C. diff was emerging, people start to notice that it was more high, that it was more prevalent in March and in the spring months. And they start to realize that this was due to the winter months and the higher use of antibiotics, and that these antibiotics were being linked to C. diff because they were disrupting the gastrointestinal flora. So they were able to then look and make some combinations. So this particular one, there's a link here because there's an assistant professor of pharmacy at the University of Texas who provided some of this information presented on it. So here's another example of complexity science where some phenomena or something happens and it actually affects things in ways that you can't always predict, and it helps guide research in this area. So transgenerational epigenetic inheritance is a phenomenon that something in the environment alters the health, and in that process it actually alters the genetic material, and not only of the individual exposed but also of that individual's descendants. So in this particular case, it illustrates a woman who smokes, and that it might affect the development, growth and development of the fetus, but the fetus itself is developing its own reproductive cells at that time, and that they may then be influenced. So they're the third generation, and the children, the grandchildren of the person who smoked, might actually be influenced by changes in the reproductive cells of the fetus that was growing in the mother that was smoking. So this is something that really helps open our eyes to some of these things and long-term effects. I like to provide the example of complexity science in action from e-patient Dave's story. Some of you may have known that he actually came to the UT Austin School of Nursing last December, and maybe some of you were able to go to his talk. But basically, this talk talks about how a variety of different things happened that led to him, after a very serious diagnosis, getting a cure. And this TED Talk was done in 2011, 4 years after his diagnosis, but he's still very active in the patient movement, and he is actually working with me on some research grants that are bringing in the patient perspective into the questions and into the interpretation of the research results. So I encourage you to view the TED Talk video that was linked on the previous slide. And if you're interested in more information about Dave, he has a book, Let Patients Help, a patient engagement handbook. And he also has a blog. And I'm also more than willing to help you get more information about Dave and about his particular story and the whole patient advocacy movement. So I hope you've enjoyed this overview of theory and how theory can be applied in a variety of different situations and how it's something that is around us, something that we live every day. And if you really think about the way you make decisions and things that you do, you'll probably realize that theory actually does help inform many of your day-to-day decisions and practices. And it's something that can be used to and applied to nursing practice. If you have any questions about this presentation or anything presented in here, please don't hesitate to email me. My email address is mbenham-hutchins@austin.utexas.edu, and I look forward to hearing from you.